A joint replacement is a big undertaking, and you'll receive lots of information along the way. An important understanding to have is what to expect before you get to the day itself. Today, we're going to talk about preparing for your hip or knee replacement. My name is Dr. Anthony Murray, and I am a hip and knee replacement specialist from Town & Country Orthopaedics. After your consultation and discussions on joint replacement surgery, you will receive an information pack containing, amongst other things, a surgical checklist. Our team will support you through each step of this to ensure the easiest flow to each step. I will take you through a few of the things to expect today. You will have a CT scan form given to you that will need to be done 3 to 4 weeks before your surgery to allow 3-dimensional printing of your bones. You'll need to call the most convenient radiology practice for you and make this appointment to have the scan done. I will be able to access the results and perform the surgical planning. You will have a blood test form given to you that will have some standard blood tests completed prior to your surgery. These will be utilised by the next person on the surgical checklist, our physician. A physician is a medical specialist doctor who will check things such as your heart, lungs and kidneys and ensure your appropriateness for the surgery on the assigned date. If they were to pick up issues or things that need clarification or intervention, the surgical date may need to be altered to accommodate this, and we will arrange that with you. You will be given a surgical sponge that you will utilise over the surgical site the night before your surgery to reduce the number of bacteria in the surgical area. We do this to reduce the very low risk of infection at the site. Sometimes we will use a surgical wash of that area instead. My patients also have a swab of their nose done before surgery to check for a common skin bug's presence. If it shows up on that swab, we treat the nose with some antibiotic ointment to reduce the potential very low risk of the bug causing infection. We will sometimes cancel surgery on the day of your operation if you have a wound or infection on the leg that may increase the risk of infection. Simple things like small mosquito bites not near the surgical site that don't appear to be infected, as an example, would be fine, but a scratch or a pimple near or in the wound area can be enough to postpone an operation. So to that end, have you got a yard that likes to overgrow quickly? Don't hit it with a whippersnipper and potentially whip up a rock that hits you in the leg, causing a wound. Just let it grow, let it grow. You can sort it when your surgery is finished. Have you got a dog that likes to jump up and scratch your leg? It's a good time to teach them not to. We don't want scratches over the knee before the operation. For everything we do with respect to your surgery, we do mitigating risk and reducing the chance of the low likelihood things that can cause an issue from ever causing a problem. Whilst we can't fully remove risks in surgery, we manage them as best possible. Risks and benefits of your surgery are always discussed at length before we ever leave our first consultation. Other less commonly thought of things are what I like to get patients to remember before surgery. If you've got a newspaper being delivered, put it on hold for a week. And a final good tip, if you live alone, have a few meals ready in the freezer for the first few days when you get home, or cash in brownie points with your significant other or neighbour for a few weeks until you're back to your cooking best. As always, I hope you learn a little. Please leave a like and subscribe to this channel to receive more educational videos on hip and knee replacements.